Good evening. Thanks, Dr. Jiyad. And as with any other medical imaging modality, artifacts are very common with OCT imaging, and it is very important to interpret them correctly to avoid mistaking them for actual pathology. Common OCT artifacts are related to either imaging technique, image processing, imaging catheter and guide wire, stent studs, and eccentric wire position. First, we'll start with artifacts related to imaging technique. There are two artifacts that are related to imaging technique. The first one is your obliquity or eccentricity artifact. As we all know, the cross-sectional imaging of the vessel occurs perpendicular to your imaging catheter. And when the imaging catheter is in the center of the lumen and parallel to the long axis of the vessel, it results in a circular image. That is what you get routinely. And however, when the vessel is large or you're imaging in a curvature, the catheter alignment is non-coaxial and the resulting image appears elliptical. What is the clinical implication of this artifact? This makes your measurements inaccurate. Moving on to the next one. Second one is your blood clearance artifact. We all know high viscous solution is required for optimal vessel clearance. When you obtain an optimal vessel clearance with high viscous solution, the lumen appears dark without blood speckles and the vessel wall appears bright. When you use a low viscous solution like dextran or saline, there is leftover RBCs in the lumen and you have blood speckles like this. So this is your blood speckle artifact. Suppose when the blood clearance is suboptimal, there is a mixture of contrast with blood produces blood swells of varying shapes. So these are the type of shapes of blood swells you get. And particularly at the end of the injection, when your contrast clearance is inadequate, your residual blood produces an artifact which is similar to your red thrombus. You can just see that. So this is an artifact. It's not a true structure. Usually occurs at the end of the contrast injection. Move on to artifacts related to image processing. There are three artifacts which are related to image processing. As we all know, optical lens has to rotate at a constant speed around the circumference for you to get a cross-sectional image. Variation in the rotational speed of the imaging catheter along the circumference results in smearing within the arc of the circumferential image. Usually occurs in vessel tortuosity, tight stenosis, heavy calcification, or equipment imperfections. What is the clinical importance? It conceals the structures in that part of the circumference and limit accurate cross-sectional measurements. The next artifact is your C-line or seam-line artifact. We all know for cross-sectional image to form, the catheter must remain in the same position till the optical lens rotates around the circumference and forms a 360-degree image. If the image wire or artery moves before the completion of the circumferential image acquisition, a single radius of malalignment occurs. So this produces an appearance of a major dissection. So this is actually an artifact. And we all know OCT is limited by a field of view. It is about 10 millimeters in an ideal vessel. That was discussed now. When the light is reflected from areas that are beyond this range of field of view, that is aliasing occurs in the Fourier transformation that gives the appearance of the far field area folded over inside the field of view. So this is what you get when you image a bigger vessel beyond the field of view. This is a typical fold-over artifact. So what is the clinical important? Portions of this image that contain this fold-over artifact should not be interpreted. And moving to artifacts related to imaging catheter and guide wire, there are three artifacts that are related to that. One is a guide wire and small bubbles in the imaging catheter results in, just see this is a guide wire. So guide wire is a highly reflective structure. So that results in shadowing behind that structure. And when you have impurities, particularly air bubbles inside, that again causes shadows. So this results in evaluation of underlying structures in these areas. The next artifact is a multiple reflection or ghost line artifact. So this is nothing but repetitive reflections within the facets of the imaging catheter that produces one or more circles that are centered on the imaging catheter. This is the first, then second time it reflects, then results in a second. So if the ghost lines are misinterpreted and use it rather than this one, use this line for your calibration, your measurements are artificially reduced. And moving on to stent stud related artifacts, we all know it is a specular structure. The stent studs are highly reflective. There results in 5 types of artifact. First, you see that because of its high reflectivity, all the photons are reflected from the surface. So you don't see the abluminal part of the stent studs. What you see is only the leading edge. and then you cannot measure your thickness. And the second one, what you see is shadowing artifacts. So that obscures the detail in that part of the vessel. Because of the high reflectivity and the saturation that saturates the detection electronics, which causes the spillover effect of this high intensity speckles, high intensity pixels to the low intensity speckles close by, that causes axial thickening or blooming artifact that makes you difficult to identify the exact position of the leading edge of your stent set. When this high amplitude backscattered signals from the stent sets saturated the processing limit of the detector, you see abnormally bright A lines appear in the image. So this is saturation artifact. When there is repetitive reflection between the stent sets and the imaging catheter, the ghost sets at multiple distances that are centered on the imaging catheter. So one time it goes up and down, then one image forms here, second time goes up and down, the second forms here, and the third time it's here. So what is the clinical importance of these reverberations? It should not be mistaken for the stent interfaces. So finally, the artifacts related to eccentric wire position, there are 4 of them. We all know central position of the catheter is important for optimal image, optimal light and tissue interaction. When the catheter is very close to or touching the vessel wall, it results in artificial increase in the brightness of the tissue adjacent to the eccentrically positioned imaging catheter. And it should not be misinterpreted as fibrous cap or macrophage accumulations. And again, when the catheter is central and right interaction is perpendicular, you get an optimal imaging. When the catheter is close to or in contact with the vessel wall, the incident light rays are tangential or parallel to the surface of the vessel rather than perpendicular to it. So they do not penetrate into the deeper tissue. This results in artificial signal attenuation in the deeper part of the vessel wall with a signal-rich surface and an attenuated deeper tissue that gives a false appearance of a lipid-rich block or thin cap fibroathyroma. And the next artifact, again, sunflower. So here we remind that images are reconstructed perpendicular to the catheter. When the catheter is centrally located, the interaction is perpendicular. You just get a normal, nice orientation of stent sets. When the OCT catheter is located eccentrically in the stented vessel, the incident light beams are not perpendicular to the stent set. Instead, they get reflected only from the edges of the stent. The resulted image reconstruction, the system thinks that it has come from an eccentric stent or orient. So that orients stent sets perpendicular to the catheter, which are similar to the orientation of sunflowers towards the sun. What is the clinical implication? That gives an appearance of stent malposition that artificially increases stent to vessel wall distance. And finally, the merry-go-round effect, again resulting from eccentric catheter position. So when the catheter is central, the sets are uniform because the distance is the same, the lateral resolution is the same. The merry-go-round effect describes an apparent elongation of the stent sets in the lateral direction. So eccentric catheteric position results in reduced lateral resolution, either from increased distance between the airlines or larger beam spot diameter in the power field. It can also occur when the catheter is in the center position, when there is an optical scattering within the lumen produced primarily due to inadequate flushing between the catheter and arterial wall, which can cause light backscattered from the stent sets to appear to originate from a wider arc rather than the correct length. It is appear to be originating from the wider arc. So that results in elongated stent sets in the lateral direction and a merry-go-round artifact that was shown in this field. So thank you for patient listening.